Good morning, good afternoon, good evening, everyone. Welcome to another episode of Divicuros Vodcast. Myself, Keith Mathew, and we have Dr. Arun Nair with us today. Say hi, Dr.
Namaskar.
Namaskaram, everybody. So, today's topic is about clinical rotations. A lot of our audience consists usually of medical students. It can be doctors, who are doctors who are newly graduated or experienced. Regardless, all of us have been through the clinical phase of our medical school careers, where we started discovering what the thing is. We kind of get used to the environment and learn a new things, learn different things every day. So the whole point of this podcast is just to introduce you to what a clinical rotation is, what to expect of it, and how to make a good use of your time at the hospital in order to enhance your skills and eventually become a good doctor. Isn't that right, Dr. Rook?
Absolutely. Absolutely. And I guess a really important thing to know going into clinical rotations is to know what the structure is like. I mean, what do you do in a clinical rotation? So, if sort of from a general sense of what this is, typically you start pretty early in the morning. Um, and the first thing is a morning meeting. And these morning meetings are very important because you review the current cases or the new cases that came in. You review the history, you review the physical examination, the vital signs, medications given. And this is very important because you have a group consensus as to, if there should be any changes made. And this is where discussions happen as well. Because, for example, if you're in internal medicine, you'd have members of the cardiology team, nephrology team, respiratory team. And often not, these patients come in with multiple diseases at the same time with a flare up of one of these diseases. And so to have a multidisciplinary approach to discuss the case and to understand what treatments are going to be used, how to manage the patient, what to look out for, this would be a very good time to observe, listen. And this is where the notebook that you bring with you to take notes in is very handy. Write down just pieces of information. This is something you got to look up later on and read about. It's very important that you take away important things from these meetings and go back and read them. I remember that did a lot of good for me during my rotations. How about you, Dr. Keith?
Well, although it's not too long ago, I'm trying to think how my different days would have been. So it depends on each rotation, I believe. So the surgical rotations usually used to be more about, like Dr. Arun mentioned, discussing it was more of like a teaching scenario where we discuss
Mhm.
different cases, different dilemmas in management, and things like that. And yes, and I do often recollect that although you're not able to understand every single thing that you go across that day, there are certain things that you may have heard elsewhere, and you're thinking, okay, that makes sense. I should probably, I do, I mean, it sounds familiar, but I don't quite remember everything. So it'd be good for me to go back and read upon that, so I can, it just reinforces what you've heard that day. And maybe if it is looking at probably during that session, you might be reading X-rays. Let's be honest. Sometimes, especially when you're starting off, reading images or reading scans are not the best of a skill set. So something you try to constantly try to improve on. So you go back home and then you try to look up different scans, learn up. I mean, use the approach towards reading scans to kind of frequently review them. So all these are important things. So the morning meeting is very important to get yourself accustomed to that day and prepare yourself well to what to expect during that day. Be it now if they're talking about interesting cases, you can make note of those cases. You can probably go see those patients, take history yourselves,
That's
perform
actually a very good
examinations.
point.
Yeah.
That's actually a very good point because another top tip is during your rotations, attending the morning meeting is very important. Make sure you're there on time, but also come to the hospital a little bit earlier. And this is where you meet your best friends, aka some of the most amazing people in the hospital, the nursing staff. This is where you build a relationship with them. Come in beforehand, ask them if you know which doctor you're going to be um, under for that week or for the next couple of weeks. Just get to know the nurses involved in that particular ward. Ask them, which cases are under this doctor. Have a visit. Maybe you may not have time to take a complete history, but establish a relationship with the patient. Wish them well, introduce yourself, and tell them you're with this doctor, you're a medical student, and if possible, you'd love to take a detailed history and physical examination later on. And more often than not, patients are happy to have medical students talk to them, examine them. It gives them a sense of security as well. So another top tip is come to the hospital earlier. visit some of these patients, talk to them, establish that relationship, then attend the morning meeting on time.
I agree. I agree.
Yeah.
So after the morning meeting, Dr. Arun, how does the day progress? What do you do after?
The day progresses. Typically, the first thing you do after your morning meeting is you meet with your doctor, the attending that you've been assigned to. Introduce yourself. This is a first impression does matter a lot. Introduce yourself, and of course, it's especially those who are just about to start clinical rotations. It is very nerve-wracking. I definitely can understand. I'm pretty sure Dr. Keith can relate with me too. I mean, it's a little bit of a sort of anxiety-provoking sort of, what will the doctor say? What do I do? I'm not quite sure how to orientate myself. It's
Also,
absolutely
you
understandable.
also you feel like you're expected to know everything, but that's close to impossible. Reason being is you're so early in. Even now, if I were with a senior faculty or senior doctor, I would still feel intimidated. Reason being that you can't know everything. It's just things that you keep learning on a day-to-day basis. And so this, I mean, although you might feel anxious, you just have to let it free. Just trust in the knowledge that you have. Just be confident in your skills. Be open to learning. Be open to criticism. People, doctors might be like, "Oh, you're supposed to know that. You're supposed to know this." Just don't take offense from it. Just take that with an open mind and just go back, read, learn. That's all.
Yeah, no, absolutely. And that's a very good point that you mentioned, because that's at that point, you're absolutely right. Don't take it personally. It's not an attack on your knowledge or your skills as a medical student or as a prospective doctor. It's something to just think of it this way. If someone's telling you, for example, you saw a case of an MI, a heart attack, and you missed out on a medication, of course it's important, right? And we're not perfect all the time. It's okay. Sometimes we do make mistakes and we might forget. And the doctor says you should be knowing this, fair enough, you have a point. Write that down, go home, make sure you know it. Task for that day, read up on management of myocardial infarctions. Come back the next day, you see another case, you know exactly what to do. It's just practice. That's why you go in medicine when you are going abroad. What are you going to do? You're going to practice medicine. This is a lifelong skill of practicing. The more you practice, the closer you are to becoming perfect.
True.
Right?
So friends, the most important thing over there is to practice medicine. Practice medicine. Practice makes perfect. You do it every day. You keep seeing new cases. You learn a few things here and there. There might be things that you didn't do perfectly. Then you kind of do it the next time. Even if you do all the things that you've learned and implement it in the next case, there are still things that you learn that are new. Just try incorporating those things. Reflect on them. That's how you improve yourself as a doctor. It's an ongoing and never-ending process.
Absolutely. And just coming back to your relationship with your attending, what I've noticed is one of the best things to do is, after you introduce yourself, the doctor most likely will give you an overview. Okay, so say you're in general surgery, they may tell you, okay, so these days are OT days. So these are days we'll be going to the operating theater and seeing cases and stuff like that. These days are clinic days. These days are just research days, or every department has a different sort of layout for their week. And usually, more often than not, they will end with, "So, do you have any questions for me?" Right? This is the best time to mention exactly what you want. So this is the time to mention, so if you're alone or if you're with a group, you can say, "Thank you so much, doctor. I mean, really looking forward to this. I'm really interested in this specialty, and I'd love the opportunity to scrub in for a procedure if you allow to do so, just to gain some experience in terms of how to scrub in, how to be in a surgical field, how to assist in operations, see the different techniques used and different instruments that are used in different cases." First-hand experience, and also just mentioning what you would like to learn from this rotation really shows a sense of initiative, and it's really encouraging for the attending to know that med students are taking the initiative to learn more. But also a very good question to ask the attending is, "I just wanted to know what your expectations were of us. What would you like us to do?" And more often than not, I've asked this question, and the attending has told me, "I just simply want you to learn as much as you can from this experience, be here on time, and do the assigned role that do your work that you're assigned to." Like, great, I know exactly what to do. There's no more sort of miscommunication because everything's out in the open. The attending knows what you're sort of looking out for, and you know what the attending's looking out for. So that builds a strong connection with your attending.
True, 100%. Whilst you're mentioning that, another question that came to mind was, usually, I'm not sure what the system is at the moment, but I think you still maintain a logbook, or you still maintain some kind of documentation in order to task the things that you've achieved. So in terms of objectives, that's also one thing to keep in your mind. I think there are a certain number of histories you need to take. There's a certain number of procedures you need
Oh,
to do. There's a certain number
that's
of
a very good point. Yeah,
there's a
but
certain number of yeah.
this
So yeah, sorry, yeah.
no,
Continue,
I'm
sorry.
so sorry to interrupt you, but like
Yeah, it's
this
fine.
is one thing that med students really sort of tend to forget.
Mm.
The logbook is there to sort of keep you on track and recommend things that you would not be able to see all the procedures listed in there or all the sort of interventions used. You're not going to be able to see all of them. It's as much as you've seen, sort of thing. But let's say they've wanted you to take 5 histories or 3 histories during your rotation. Do not stick just to 3. Make it a rule that every day before you leave the hospital, you've taken at least 2 histories and done 2 physical examinations every day you're in the hospital. It will take about half an hour to 45 minutes for 2 patients. History and physical, the best thing to do it is with a friend, so they can evaluate how you're doing, and give you tips on improvement and stuff like that. If you do this, I guarantee you, by the time it comes for your practical or your OSCE exams, you're not going to be nervous about approaching a patient or starting a conversation with them. You are going to be so comfortable with this, you won't believe it.
Absolutely. And well, that's just a wonderful point, really. The reason being is uh, every day, like Dr. Arun mentioned. Uh, so let's take let's say if you're in cardiology, even if it's not just cardiology patients, any good patients that you see, if you just use the structure, you have somebody with you, just take the history properly, not just like have a chat and just go back. No, go with the proper mentality of getting the demographics, the presenting complaint, proper things to ask, history presenting complaint, hit each and every point. Use the system as much as possible, even when it comes to examination, physical examination. If a cardiology examination is warranted, do it in the exam style. Don't be like, oh, what will the patient think? I mean, obviously do consent and do those things, but don't try to learn the half way of doing things. Not just like, okay, I'm just going to auscultate and go. No, so the patient is there. You've got time. Just start with general
And
inspection
and
on
honestly,
everything.
like if you feel like it's a sensitive question, tell the patient.
Yeah.
Just tell the patient simply, I would like to ask you a question now, and I know it's a bit sensitive, so I apologize if this question is uncomfortable, and if you don't want to answer it, it's absolutely fine. And then you can ask them. So if it may be about substance abuse, it may be sexual history, it may be some sort of further investigation into family history that may be uncomfortable for the patient, but give them a disclaimer that this following question may be sensitive and may be uncomfortable. If you don't want to answer it, we can move past it.
Guys, also one more thing. So since we're so used to with this cultural sensitivity thing, when I did a couple of rotations outside, like in the UK and the US, I used the same approach, and then they were like, "What's like? Why are you feeling so uncomfortable or feeling that it's a sensitive issue?" It's like just ask
Uh,
it out straight. And I mean, I actually one of the patients actually told me that because I was it was about sexual history, and I'm like, this might be. I said something along those lines, and I'm like, sorry, what? Yeah, I do engage in sexual activity. With this and that. We can't find it as normal. So cultural sensitivity is important. So if you are in a more culturally reserved area, it's maybe it's a good way to start off that way. But yeah, just be culturally appropriate. That's all.
Absolutely, yeah. Now, this is interesting. We've looked at this from the student's perspective. What has your experience been with regards to different types of clinical tutors?
Um, just I mean, mostly I've had mostly good clinical tutors all throughout my rotation. Uh, you obviously hear gossips here and there before you start about what to expect from each person, but I think how your rotation comes out depends on what your personal relationship is with that tutor. So
And how
if
much
you
effort
do
you put in?
exactly, so how
Yeah.
so what relationship you have with the tutor and what effort you put in. Now, an ex-person's experience might not reflect what your experience might be or what your experience is. So I would
Mhm.
just always, whichever tutor you have, go in with an open mind, kind of like Dr. Arun mentioned, make your objectives clear, ask what's expected, put your 100%. Don't think about coming to hospital and going home as soon as possible. Use the time
Oh
wisely.
yeah, please don't do that.
Yeah.
That's I mean, the opportunity to go to a hospital to do rotations is the best thing for your medical career. Here's the
I
top
mean,
tip. Here's the top
yeah.
tip, and I'm pretty sure
Mhm.
Dr. Keith would agree with me. You want to be a good doctor? The more patients you see, the more experience you gain, the more time you have to practice the knowledge you've studied, the better the doctor you become,
I agree.
right?
Yeah, absolutely. But again, And actually, that clearly shows in your clinical practice as well. When you start practicing as a doctor, the amount of time you've spent with patients, it kind of naturally shows because you feel a lot more comfortable and you feel like home when you talk to patients, and you just feel like I've been doing this for a while. It's not something that you have to newly kind of grow or basically build up. It's just like I've
Yeah,
been seeing patients all throughout my last 3 years or so. So this is just natural. And every single day is a learning experience. So that's very important, guys. Very important to spend adequate and ample time and make use of your time in the hospital. Right.
absolutely.
Uh, Dr. Arun,
Yeah.
apart from, so we've talked about how a clinical rotation is, we've talked about objectives, we've talked about what to expect and how to plan things. Anything else you'd like to add in terms of anything else you'd like to add, like how would students make better use of clinical rotations or anything of that sort?
Absolutely. And if I may say one last thing about rotations is a lot of students who are entering clinical rotations would be studying for board exams, such as like the USMLE exams. My best advice to you is, yeah, sure, everyone knows that, you need to manage your time well, need to be consistent. That's all sort of general knowledge at this point, because you must have heard it from multiple sources. But I would suggest one of the smartest things to do with this is to tie in what you're studying in your board exams with what you're doing in clinical rotations. So you will have a schedule of what rotations are coming up to a certain extent, or maybe the full list. You never know. But with the information that you've been given, tailor your studying of what you're studying for steps with the rotation. So, for example, if you have 1 week of cardiology, schedule, okay, I want to finish cardiology in that week. So not only do you study from the books and the videos that you're watching and the questions that you're doing, but you get to go in and apply it into real life scenarios. That way, when you apply that knowledge to a real patient, that knowledge sticks because you're going to remember that patient, right? And remember the discussion with the doctor. So if you schedule it that way, trust me on this, you are going to be flying through this. You're going to be very happy with yourself that you're not only studying well, but you're becoming competent as well.
Exactly. One more thing I'd like to add is research at the end of the day is very important. Having good research in your portfolio, it
Yeah,
adds towards if you're applying for specialty application residencies, just your personal knowledge in general and your skills in general. It's very important to have good research. So when you're in your clinical rotations, once you kind of get used to the scenario, you get comfortable, and if that is your preferred specialty, do not hesitate to ask your tutor or other doctors who are in the field, on opportunities. Always be proactive, and more than likely, or there's a high chance that these doctors are working on different projects, be it case reports that they're actually looking for somebody to write, literature reviews, could be primary research. They're just looking for a pair of helping hands. So at the end of the day, even though you're not the primary author, you are getting used to, or you're seeing how projects are run, and you're being a part of it. And then at the end, you can start your own projects or your own research. So it's always good to look for research opportunities because a lot of my new colleagues or people who are coming into medical school, they keep asking me, so what do I do in terms of research and things like that. So this is what I tell them as well. So just want to share that with you guys. Okay.
absolutely. And I think we should also consider maybe doing a podcast on what is research,
We will,
right?
and absolutely, and we have been talking
Yeah,
about it. So we will be doing a dedicated podcast, dedicated series, maybe a lot of different things that are very much research focused, so our peers and colleagues can, kind of master this, and it'll be good for everybody.
absolutely.
Wonderful,
Absolutely.
wonderful. Thank you very much, Dr. Arun. I think we have had a very good discussion, a very good talk about clinical rotations in general, and I'm very sure that our audience or our colleagues listening to us will highly appreciate what we've discussed today. Um, so that's it from my end. Anything else to add from your end, Doctor?
Well, I mean, I just want to wish all the medical students the best of luck.
Yeah.
It's going to be hard. It's going to be tough,
Yeah,
right? But I mean, at the end of the day, it's going to be totally worth it.
absolutely. And so with that, we end this podcast, and we would like to say thank you at the same time. Nandi,
Me,
Namaskaram,
namaskaram, pakala.
Pakala.